for your health tonight. Dr. Bruce Hensel is here with more about new advances in prostate cancer. Dr. Bruce.
Well, Colleen, a major advance, I'll tell you why it's so important. The PSA test, far from perfect. Many biopsies miss cancer, like Governor Brown's, and some biopsies are just unnecessary. We don't have tests for prostate cancer as good as mammograms for breast cancer. This one is not the final answer, but it's a major step forward, a new type of biopsy that may have saved this man's life. One prostate needle biopsy is unpleasant enough, but Don Buck had 2 of them. He got them because his PSA levels shot up dramatically from 2 to 13.
It's more like a pinch, but it is in a sensitive area.
In conventional biopsies, doctors insert a needle into the prostate and take up to 24 random tissue samples and send those to the lab to see if there's cancer. But nothing turned up for Buck.
I felt, well, perhaps there's something wrong with the PSA test.
Buck's wife convinced him to get a new type of biopsy, one that's far more precise and maybe more accurate.
Rather than doing a systematic blind biopsy of the prostate, we can now do targeted biopsy and assess the tumor tissue directly. Previously, this was impossible.
First, the patient gets an MRI that pinpoints the subtle differences between normal and cancerous tissue. Then, those MRI images are superimposed over live images of the prostate done during the biopsy, so the doctor can be sure he or she is biopsying the right area.
So what this new technology allows us to do is to put the needle directly into the tumor and to evaluate the size of the tumor and the severity of the tumor.
The new targeted biopsy found invasive cancer in Buck's prostate. The good news? It was caught early. If he had just let it go, it might have spread.
They're going to take care of the surgery, and I have no problem with the surgery. I believe I'm in good hands, and I know as a result of all this, I believe I'm going to have a long life.
Now, 2 important points to make this useful for you. Do not rely on PSA alone. Men should get a PSA and an exam. If the PSA shoots up a lot or very quickly, a biopsy may be necessary. If you need one, ask about this new option. It may save your life. Back to you.